Yeah, well, we sometimes have patients who come in who are trying to get pregnant and having difficulty getting pregnant or having difficulty conceiving. And sometimes that may be that they just haven't been trying for long enough, because we know only about 20% of pregnancies will occur each cycle when a woman is trying. So a woman has 20% chance of falling pregnant each month if she is actively trying to conceive. So it's not unusual for it to take up to a year for a couple to be able to conceive, even if there aren't any problems. So when women stop taking the pill, sometimes their normal cycle won't be what they expected it to be, because they've had this false reassurance of a normal cycle on the pill. So sometimes it's important to make sure that women are aware that it's not as a result of being on their contraception that they're now not having a regular cycle. Some women do feel that there's a problem getting pregnant after taking contraception, and there's no evidence for that at all, that any of the methods of contraception other than the injection can delay your return to normal fertility. And in fact, most methods of contraception that we use are immediately reversible. So a woman can theoretically fall pregnant within a week of stopping her method of contraception. So some people don't realise that they can fall pregnant quite so quickly. Sometimes people are maybe a little bit overly zealous in trying to get pregnant, in that they're having sex very frequently, so having sex every day, which can sometimes put a lot of stress on the relationship as well. And we know it's not necessary to fall pregnant to have sex every day, or to necessarily pinpoint the perfect time to have sex. Because the basic science behind it is that the sperm will survive for 3 to 4 days on average, and sometimes even longer. So if a woman is wanting to fall pregnant, so long as she's having sex 2 or 3 times a week, then she's giving herself a very good chance of conceiving. Sometimes there can be problems, and they need to be identified in couples. And one of the other misconceptions is that it's usually the woman's problem that if there's a fertility issue. But we do know that 30% of the time it's actually a male factor that's involved in infertility. And then if it is taking women and couples longer to conceive, if it's taken them over 6 months and the woman's over 35, then we would recommend that she maybe seeks some advice at that stage, or the couple seeks advice. But for women under 35, if there's no identified reason for them not conceiving, then up to a year of trying is certainly what we would recommend before we'd start rushing into investigations that can then sometimes just provoke anxiety unnecessarily.
Yeah, right.
So there's a weird model. Look at that. How's that? It has been shown across many studies over the past decade that the amount of information people know about their ability to have babies doesn't necessarily reflect what's actually going on in their bodies. And there are 2 things that come out in relation to that. The biggest one is that we think that we have the same chance of getting pregnant and having a baby at the age of 25 as we do at 35 and as we do at 40. And the Fertility Society of Australia has spent a lot of time and effort trying to educate the population in regard to that. Unfortunately, it doesn't appear that has had huge inroads into a lot of the population.
Why do you think that might be?
I don't think people necessarily pay attention, to be perfectly honest. And not because they don't think it's important, but if it's not something that's directly related to anything that's going on in our lives at the moment, we kind of go, yeah, okay, whatever. And it's only when we're starting to concentrate or when we want something that we pay attention, and that information may have been missed and we don't remember it. I think one of the things that the amount of information around is that we're able to actually resource or research information for ourselves in a private setting. And when we're looking at something that is quite personal, something we don't necessarily want to share, something that society says, well, look, if you're not getting pregnant, there must be something wrong with you and we don't value you as much. And that's something that's a big message from society for a lot of our patients. That you then want to sort out what's going on by yourself. And with the availability of the World Wide Web and the availability of these particular apps to do that, I think that people choose that in the first instance. And as they're educating themselves, then they can move forward to some of the other things that we used in the past. When I talk about IVF with my patients, what I'm trying to do is provide them with information so that they can see the circumstances from the reality of the circumstances rather than what we want. Okay, and our expectations and reality for many things are often a long way apart. The reason for this is that even the very best of circumstances, the worldwide literature says that not more than around about 1/3 of women are going to have a baby each time in an IVF cycle where eggs are collected. And that's not really the information that IVF units get across. They in general suggest that the chances of pregnancy and babies are much, much higher. Now the reason that people don't get pregnant as often as they do with IVF is that most of the time the eggs that are produced as part of the normal menstrual cycle, most of them don't work. They don't work either because the genes in the chromosomes haven't divided properly, or the structure inside the cell that helps run the cell hasn't got all the components to it that are required to make a person. And in those circumstances, the hormones are produced by the woman's body. She has a menstrual cycle, but she gets a period. We don't know. What we see is that really by the time women are at 25, she's probably only producing one egg every 3 to 4 months that can make a baby. By the time she's 40, she may be only producing one a year that can make a baby. Now realistically, if people have an IVF cycle in a month that they're making an egg that can make a baby, they're going to make a baby. Trouble is we can't see that until we've got the eggs and see how they're done. There's no technology for us to be able to do it forward yet. And so this is a really, really important way of looking at fertility treatment so that we have a much better idea of really our chances of having a baby and sticking at it until we actually get that month where the egg is there that makes a baby. And then people get what they want.